Also, the digital technologies encompasses wide range of tools and systems techniques that is designed mainly to improve the patient care and streamline operation, enhance the medication management, and even the medication safety. So let's talk now about the digitalization trends in pharmacy practice. We'll start by number one, which is very common for us at the pharmacists, which is e-prescribing. Actually, as we know, in the last decade, we changed completely from the handwritten traditional paper prescription to electronic prescribing, or we called it e-prescribing. This technology was very important because it's helped a lot of the patient care, a lot of healthcare provider to act more precisely with the prescription. Before, the handwriting sometimes is not clear, as there's some mistake in prescribing the medication, in dispensing the medication. But now when we have this electronic prescribing system, that will reduce the error, improving the prescription accuracy, and actually help the process to be faster and more efficient. As we'll see, even it will integrate very well with the robotics and automation of pharmacy practice and pharmacy practice delivery. The second trend now we are having is telepharmacy. And telepharmacy actually is the remote interaction between a pharmacist in a remote location with a patient in underserved or rural area or place we cannot reach it personally by the pharmacist or pharmacist. Actually, telepharmacy also was a very good option during the international pandemic of Corona, because we have more of safety for the patient and for the pharmacists themselves. The remote pharmacist can have all the pharmaceutical care services remotely from the location. So he can have the consultation, the counseling, have the medication management services like drug-drug interaction and adverse reaction checking, everything like this. And that can be delivered to a patient in places that are underserved in pharmacy practice, or it's not accessible to our in-person pharmacy practice. The third one is the medication management applications, and that will be the future in pharmacy practice and patient counseling and patient communication. We have a lot of smartphone application now that's dedicated for medication management, which empower the patient and the healthcare provider to control better the adherence and monitoring of the medication administration. These apps can provide a reminder for the medication, dosage tracking, medication interaction alert. Sometimes even you can use it for checking if there is any incompatibility of certain mixing or something like this. And that will improve or enhance the adherence and improve the therapeutic outcome and attainment of the therapeutic goal for the patient. The fourth trend in the pharmacy practice and in the digital era is the electronic health record. Actually, the electronic health record is well known in hospitals, and all the physician, nurses, and even all healthcare providers inside the hospitals are using it for decades. But it's now something can be shared to the pharmacists themselves, not even the hospital pharmacy inside the hospital, but with the community pharmacists and pharmacists in healthcare outside the hospital, which will help the pharmacists to have direct access to the patient medical record. And that will help the patient or the pharmacist himself, instead of asking the patient a lot of questions about the history, so he can counsel the patient better or choose better medication, or even for the over-the-counter medication. Now he have the ability to access the patient record with all the labs, with all the history, with the medication prescribed from different physicians with different specialty. That will provide better care of the pharmaceutical care point, and at the same time will decrease the duplication of effort. Sometimes you have some services or monitoring or labs done by one physician and it's done by other physicians. Pharmacists have certain counseling points that already have been addressed by the physician. So this electronic health record access to the pharmacist in the community pharmacy or the pharmacist in general will help a lot in improving the patient care and pharmaceutical care for our patient. Actually, this point is, I think it's present and addressed very well in Western country, USA, Canada, UK, and something like this, from like 2000, 2005, something like this. But I think we are lacking this access to the electronic medical record of the patient by the pharmacist in our Middle East and Arab world. The fifth and maybe the last one and the most new one, it's automation and robotic in pharmacy practice and pharmaceutical dispensing. Actually, nowadays we can depend on the electronic prescribing to send it to an automated bots or robotics in the pharmacies, and they do the dispensing by themselves. They get the boxes, count the tablet, check for names, for dosage, everything. And actually, that will reduce the risk of human error. It's making easier for the pharmacist and less time consuming. So the pharmacist will have better time and more time to focus on patient care and counseling the patient about the clinical condition and how he can monitor his condition and something like this. So it will be less administrative dispensing work and more of clinical services for the pharmacist, which will improve also the patient care. Actually, automating the pharmacy practice and this dispensing machines, robotics, is already present nowadays in our Arab world. Like in United Arab Emirates, we have, before when I was serving there, we have collaboration with different hospitals. They have this robotics, and actually it's amazing. They get almost zero error, and it save a lot of time, and it actually help the pharmacist even to do more of counseling time and checking about the medication record for the patient. Let's talk now about the benefits of digitalization. Actually, digitalization added a lot of benefits to our pharmacy practice. Number one, it's most important, improving the patient care. All digital tools that we are using and we are going to use in the future will have important aspect to get a real access, a real-time access for the patient medical record, as we said. It's enable personalization with adjustment of the dose and counseling for each patient. Intervention will be more accurate and personalized for our patients, specifically patient per patient. That will improve the safety and improve the therapeutic outcome we looking for. Number two, for the benefits are enhancing the medication adherence. Actually, presence of this, like we said, medication management applications, and if the pharmacist work with the patient, how can he use this application? And there is some monitoring from the pharmacist or even a healthcare provider like a physician or physiotherapist or something, that will improve the adherence for the patient, improve the medication monitoring by the patient, so he will not be forgetting some of the doses or taking multiple doses by mistakes. That will help also the attainment of the therapeutic goal and improving the monitoring for the patient care. Number three of the benefits are streamline the operation. Streamline the operation means that we have this operation administrative burden related to the prescription, reading the prescription, dispensing, checking, and everything like this is getting for the automation system, as we said, and that will save more time for the pharmacist to get the patient care point to, as we said before, looking for the history, looking for the algorithm for decision making, and try to counsel patient, monitor the patient more, and so on. So it will take a lot of burden, administrative burden, from the pharmacist to a clinical decision making and clinical contribution to the patient care itself. Number four, which is very important nowadays, also the medication safety. Digitalization will reduce medication error through different feature, like a drug-drug interaction check, like checking about abnormal higher dose, lower dose. Sometimes they give you some system like Epic system, for example, give you alert if you have very high dose. So if it's instead of 100 milligram, for example, so it's written by mistake 1,000 milligram, it will get you alert flag and you will not be able to dispense this medication and something like this. So that will improve greatly the medication safety, either by decreasing the dispensing error or the dose error or prescribing error itself. As everything we have in life, everything have benefits and drawbacks or challenges or some challenges we have to overcome and we have to face. In spite of all this advantage of digital system and digitalization of healthcare, we still have some drawbacks or challenges. Number one, which is the most important now, and we all sure about this, the data security. Collecting all the data, collection of all the health individualized, important information about the patient himself and storage on digital place, in internet or even in hard disk, whatever, that will have a high risk of insecurity of the data. That's why we have to ensure the protection of the sensitive patient information, and that will be a crucial point for success of digitalization in pharmacy practice and in everything, even in like we have in internet banking, for example. If you are not very secured about your information about your bank account, everything, you cannot use internet banking. So we need to be sure about this. That's a problem we have to address. The regulatory compliance. Actually, we have now the digitalization regulations. So the pharmacists have a lot of complex regulatory framework to navigate and go through it. So, for example, there is a specific regulation for telepharmacy, specific regulation to use certain programs for checking about electronic prescribing standards. We have what's called the HIPAA Act about the insurance and the portability of accountability in insurance company. So all of these regulatory compliances are hard to be navigated by the pharmacist and need to have some experience. So this is also a problem that we are facing through digitalization of pharmacy practice. Number three, I'm sure it's training and education. We have a major issue for pharmacists and pharmacy staff to have ongoing training and improve their education about digital era and digital work, especially the old generations, because sometimes they are not that familiar with how to use certain programs, how to be navigating even the internet or something like this. So we need to have something or some regulation to improve the training and education for the pharmacist and pharmacy staff to be up to date with all the digital era that we have now and the evolving technologies that we will be facing in the future even. Number four, and that's something actually we have a lot of discussion about it in the WHO when we have our last meeting, the health inequity. Actually, digitalization of healthcare as a general, like digitalization of pharmacy practice and digitalization of anything, sometimes that cause inequality between patient or people even. Because sometimes if you are not accessible to this digital tools like smartphones, like internet, you cannot use certain programs because it's expensive or you are not familiar with it. That will deprive you from utilization of, for us as a healthcare provider, you will be deprived from having a lot of things related to the healthcare service. And that's why we need to be addressing this point also. That's valid for everything. Even as the same example as I said in internet banking, if you are not having laptop, you are not having digital smartphone, you will not be able to use your internet banking. So if you imagine that everything is digitalized, like some service, I used to live in UAE for 16 or 20 years. So a lot of services there is only digitalized. So if you are not able to submit your application digitally, you will not be taking this service. That's why they have certain offices to provide care and help for patient or not patient, even people who cannot use the digital systems, digital accounts, and so on. So we need to do this also.
Excuse me, Prof. Osama, you have 1 minute more, please.
Okay, no problem. So that will be improving our, we have to do this to improve our digital health. As the future of pharmacy practice in digital era, we will be having an introduction of artificial intelligence. It will be very important even in counseling, that will help us. Telehealth integration, we have to integrate telehealth in all the process together, from prescribing, dispensing, counseling, everything. We need to deal with new technology like blockchain and drug traceability, because that will help decrease the counterfeit medication by being sure that this is authentic medication and safe. We will be also dealing with, in the future, with virtual reality in education for pharmacy practice. So our patient will be having better services, because our student will be trained better in safe and simulated environment about patient care and providing clinical skills. Actually, the recommendation, I will be just telling the points. We need to invest in our ongoing education and the training for pharmacy staff and pharmacists, and even our students. We have to embrace interoperability. So all the system used in different processes should be compatible with each other. So we will be having the automation, the prescribing e-prescriptions, the readings, the drug interaction checking. All of them can work on the same system, like we all working on Windows, for example. It's not being have a problem between Windows and Mac and everything like this. Number 3, strengthening drug security measures. As I said, we have to have some thing to do about this. Promote the patient engagement. We have to educate the patient about the digital health and how we use this services. How can we train them? We have to talk with regulatory bodies about these problems in the standardization of regulation, and how it should be clear for the pharmacist and the healthcare provider, so everyone knows what should license he get and how can you use it. Embrace emerging technology, all the emerging technology, new one, like we said, the blockchain and everything, we need to be able to take it in our pharmacy practice, and prioritize equity in digital health, as we speak in a minute. Lastly, we have to foster collaboration in healthcare. That goes without saying, like everyone talked before me. We have to have a collaboration between pharmacists, physicians, nurses, physiotherapists, everything on the same page. And even as we said, and we talked before, my professors, about the interprofessional education. So we have to have courses for all of them together about digital health and digital application. I think that's it for me, and that's the conclusion. I have only put here some references for your reference if you need to read more about digitalization of healthcare and pharmacy practice specifically. Thank you so much for your attention, and I'm happy to take any question at the end of the session. Thank you.
Thank you, Doctor. We will have our question after the second session.